So, good afternoon, everyone, and thank you so much for joining us. I'm terribly excited about today's session because it's a new technology and I think a very empowering technology. So with that, I wanted to have a very brief introduction to what digital twins are from my perspective. Why should we care in healthcare? And what does machine learning have to do with it? Next. So, digital twins are dynamic virtual representations of a system. And the system could be a physical system of an individual, a patient, for instance, but that could also be a biological entity. It could be an organ, it could be a tumor, it could be a collection of organs. But we could also have digital twins at a higher level. We could have healthcare systems being digitally twinned, or why not a clinical trial? Next. And while today we are going to talk about medicine and healthcare, and this is the area that I am terribly excited about, the reality is that digital twins can make an impact in other domains such as education, finance, organization, cities, etc. So, what are we really envisioning here? And how are these digital twins being built? They use real-time data as well as whatever other observational data we may have, as well as knowledge, whether it is mechanistic, physiological, or pharmacological, as well as machine learning to simulate how the real world would behave. And why do I really care so much about this area? We have worked over the years quite a lot in terms of building analytics, whether for prediction or for causality, to try to estimate the effect of a treatment on an individual. And the reality is that whether it's a predictive model, a risk scoring model, or a causal effect model, we want to really make the clinicians confident that whatever we are doing does indeed make sense. And for that, what we really need is not only analytics, but we need to have what I'm going to call wind tunnels. And you see here indeed the wind tunnel that is stress testing a particular component of a plane. In a similar way, we need ways to really envision what would happen to an individual if indeed we would act in a particular way, or if we would unroll subsequent scenarios. So this, if you like, wind tunnel is a digital twin, and I believe that it can help us understand better a particular individual or ecosystem, test hypotheses, but also timely and correctly intervene. Next. So in medicine, this could have impact in terms of personalized medicine, testing predictive analytics, and also enabling early diagnosis, a topic that's very dear to our heart, but also enable operational efficiency as well as provide insights for accelerated innovation. Next. So quantifiable benefits from this could be, for instance, and here are just a few, and I'm very keen to explore together with the panel many, many more, improved patient outcomes. Because, for instance, we can identify and predict early, and not only predict, I shouldn't use the word predict, we can really unravel what will happen to a particular individual or patient population and determine early that they are at risk for a particular morbidity or mortality, and we can intervene. But also in terms of cost saving, because we can really think about what are right interventions to do in a clinic or in a hospital to maximize, for instance, patient benefit. And last but not least, digital twins could be also very useful for enhanced accessibility, providing a broader reach of medical expertise via a variety of virtual platforms. Next. So what do we have in terms of core components? Very importantly, data and diverse sources of data, and data that's both observational in nature, but also real-time data. In terms of machine learning, generative models, combined with knowledge we may have, either physiological or pharmacological, and feedback loops, where as we gather more data about the physical system, we can update continuously the digital twin. Next. So how can machine learning help? We are talking here not about predictive models like we usually do in our Revolutionizing Healthcare, where we talk about risk prediction models or time series forecasting model or causal effect inference models. Here we talk about generation and generating these possible futures of this individual. So generative models are key, and also we need to do generation and validation as well. We know that as we move maybe further into the future, or if we want to create digital twins of less often present in the data individuals or scenarios that are less often represented, we also need to validate those as well as provide uncertainty quantification associated with this generation. Next. So at this stage, one may wonder whether a topic that we have often talked about in Revolutionizing Healthcare, synthetic data, is what digital twins are all about. Next. But the answer is no. There are some similarities with synthetic data, but there are also some key differences. Similarities are the fact that we want to simulate and represent real-world data, and privacy is a key consideration in both cases. And also, in different ways, synthetic data and digital twins can be used for decision support and decision making. But there are differences. While synthetic data focuses on really characterizing and generating population level data sets and data sets that are really synthesized through the process of synthetic data, in digital twins, we are focusing on synthesizing the individual. Also, while in synthetic data, we focus on static and generated once data sets, in the digital twins, we are continuously gathering new information and updating the twin. In terms of interventions, synthetic data is just capturing whatever interventions may exist in the data, but in the digital twin, they are becoming essential because what we want to do is scenario planning and consider the effect of all sorts of interventions that may not necessarily be existing for this particular individual, and hence we need to unroll these future scenarios. Next. So what about causality, which is another area that may seem similar since we are talking about using digital twins to think about interventions? Well, while both of them are useful for supporting interventions and do outcome prediction given a variety of interventions, as well as providing us with insights under different types of dynamics and scenarios, there are also key differences. Next. And these key differences are, again, causality focuses on estimating causal effect from observational data, while digital twins are very much about real-time simulation at the personalized level. Also, in terms of data, again, we have this difference that causality works on observational data sets, while digital twins may be trained on both observational and real-time data. Next. So the two, though, are also complementary because causal knowledge can empower digital twins. And conversely, next, testing causal hypothesis is hard, and digital twins may provide a virtual environment for us to do so. If you want to hear more about technology in machine learning that is unraveling as we speak in terms of digital twins, I invite you to watch an Inspiration Exchange, which is our sister session that is aimed at machine learners, where we have looked just yesterday about the technology of digital twins and what are the challenges in machine learning and some progress. Next. And I'd like to say a few words about some very recent work in our own lab, not because it's the only technology, there are others, but just to give you an idea about what is possible. And this is work on hybrid digital twins. Yeah, it's good. Together with two PhD students in my lab, Sam, Holt and Tennyson Liu. And what we do in this digital twin, we do look at both mechanistic models for building digital twins that are based and grounded on biological or physical principles, and combine them with neural ways of building digital twins. And both these two technologies have been used for building digital twins. But the reality is that both have their strengths and weaknesses. So this is why we decided to marry the two of them. Next. So we built hybrid digital twins that are hybridizing mechanistic and neural models together. And what we are trying to do in this work is automatically determine the parametrization of these different digital twins and optimize them given the available data at hand. Next. So in our work, this hybrid digital twin, we use large language models to enable us to do that. And we have a novel evolutionary approach to do that. And this is done in 3 steps, utilizing the large language model as a generative model to iteratively propose digital twin specification, then offline optimize the parameters from training data, and then the model performance is automatically evaluated back to the LLM, and we are continuously improving that. So this process is repeated over multiple generations until we are satisfied with the outcome. Next. You see here just a brief snapshot of the work. I'm not going to go into the details, but you see how this large language model has different types of components for model generation, parameter optimization, evaluation, and then reflection on the basis of each, which leads to new generation. Next. So this is my last slide. I'm very excited about digital twins because I think that they have the potential to really empower a variety of areas in medicine and healthcare. And I can't wait to talk to the 4 panelists about that. I have many questions to them, many things I do not understand, and also I can't envision, and I hope that they will lead us. I also am excited from a machine learning point of view because I think that this is emerging technology in machine learning. And again, depending on the requirements and needs, I think a lot of new ML is necessary. Thank you.